that Lutathera is the first approved medicine in a class of drugs called peptide receptor radionuclides. This is a really exciting type of drug because it is like a smart bomb. It basically is a combination of a drug which goes specifically to cancer cells that are called neuroendocrine cells, and attached to this drug is a little radiation molecule so that these basically particles go straight to the tumor cells and target them with radiation as opposed to exposing normal cells to radiation. This is very specific for a rare kind of tumor called gastroenteropancreatic neuroendocrine tumors. It's a mouthful. We call them GEP-NETs. And basically these are tumors that affect about 1 out of 27,000 patients. And the tumors that historically have only been able to be treated with a medicine called sandostatin or octreotide. So it's a very small group of patients who are actually candidates for this, but again, this is the first in an emerging subgroup of medications, so I think there will be other cancers that can be treated with medicines like this down the road. And the actual drug works as an infusion, so patients come in and they're given some special medicine to help protect their kidneys, and then they're given an infusion through a vein, which lasts for about 45 minutes, and then they're given a lot of other fluids after that to help the body flush out the radiation particles. The infusion is given once every 8 weeks for a total of 4 doses. Lutathera was approved because it's actually revolutionized how well these patients do. Previously, if patients failed octreotide, there were no really good therapies. But in randomized studies, there were 2 large randomized studies which looked at Lutathera compared to the best treatment which we had previously. And Lutathera reduced the rate of progression of disease by 79%. The survival in patients treated with Lutathera had not been reached in those studies, whereas in the patients who received standard therapy, the survival was on the order of less than a year.